We remind you today you can talk to the experts from the Better Business Bureau with your consumer questions at 859-294-6090. Well, speaking of questions, the Lexington-Fayette County Health Department has some questions for you about the health needs of our community. And here to tell us more, we're pleased to welcome Health Department Communications Officer Kevin Hall to tell us how this is going to work and what you may see in your mailbox over the next few days. Thank you so much for being with us today.
Well, thanks for having us, Christy.
Tell us about this whole project of getting this health assessment done for our community.
Well, this community assessment survey is called Pathways to Wellness, and it's a chance for the health department to hear back from the people of Lexington. We're looking at the health, environmental, and social concerns that matter most to the people who live here.
And, of course, this is a census year, so a lot of us have kind of gotten accustomed to filling out some of these surveys and things. What are some of the questions that folks can expect to see from the surveys?
One of the things, we can't really go into details on the questions because that can bias the results, but we can let people know that these are going to be we want to look at the things that matter most to them. What kind of health insurance questions, what kind of environmental issues matter the most to you. You get a chance to rank those and send those back to the health department.
So since this is a BBB day, we were talking a little bit earlier about if you get the notice from the health department that it is legitimate, and folks could start seeing these by the end of the week in their mailboxes.
That's right. They're going to start going out in mailboxes on Friday, so along the weekend people should be seeing those, have a chance to fill those out. They take about 10 minutes to complete. There'll be a pre-addressed stamped envelope in there for everyone to turn those back in by July 6th. We want to make it as easy as possible for people to participate, fill them out, and get them back to us.
And even if you don't get one in the mail, there's a way for you to participate online.
Right. People who want to take part but didn't get one in the mail can go on our website, lexingtonhealthdepartment.org, and they can fill that out electronically through SurveyMonkey.
And aside from being able to help with the assessment, there's some extra incentives if you participate.
Right. One of the things that we found out is if you want to be able to get good results back, you've got to be able to give something to the community to kind of encourage and incentivize this. So the first 1,000 people who respond will receive $5 gift cards to Walmart. And then everyone who responds has a chance to receive one of 3 $500 gift cards. So these are some pretty good prizes. Again, 6,000 people will be getting these, and it's open to anybody in Lexington for the website. So you have a pretty good chance of winning.
And as we know, we've seen so much in the last year with H1N1, so many public health concerns, and you guys really need this information to plan for the future, right?
Yeah, this will not only help shape the health department's programs, but this will also be shared with our community leaders, government officials, so that people can know what are the major interests, where does the money need to go to, where do the services need to go to, and who needs the services most here in Lexington.
Well, again, you see the details there. You'll start receiving those if you're among that 6,000 that are getting surveys by the end of this week, and you're asked to send them back by early July. Health Department website on your screen for more information, and you guys are pretty active on social media, too, with Facebook and Twitter.
Right. Anybody who wants to find out more about the Health Department can find us on Facebook and then at twitter.com/LFCHD.
Great. Well, thank you so much for being with us today,
Kevin.
We will be right back with one last check of your forecast.